Well, good afternoon, everyone. I am here with the Illinois Department of Public Health Director, Dr. Ngozi Ezike, to provide an update on Illinois' progress vaccinating the public, as well as our gradual path back to normalcy as we work to bring this pandemic to an end. Dr. Ezike and I are joined today by Dr. Rodney Alford, a pediatric and internal medicine specialist and an Illinois State Medical Society trustee. Dr. Paul Peterson, the Vice President and Chief Medical Officer at OSF St. Joseph Medical Center in Bloomington. Dr. Whitney Lin, who works at the Sengstack Clinic at Cook County Health's Provident Hospital. And Deborah Murphy, a home child care provider and a member of SEIU Healthcare Illinois. Because of our state's incredible workforce of healthcare professionals and our exemplary National Guard, Illinois is continuing to run ahead of the national average for vaccinations. 60% of our adult residents have already received at least a first dose. That includes 85% of our Illinois residents 65 and over. Most of those millions of shots took place at mass vaccination sites, at local health department clinics, at pharmacies, and at hospitals. These shots largely went to people who were immediately eager to get vaccinated. Many refreshed pharmacy websites, many called on behalf of their elderly relatives, or drove to another county nearby, or even much further. The days of vaccine scarcity are over. Today, we are in a new phase of our vaccine administration plan, of meeting people where they are and making sure that they get their shots, perhaps at their doctor's offices. So today, we're initiating the expansion of vaccine administration to physicians' offices across the state of Illinois, allowing them to become COVID-19 vaccine providers for their patients right there, and right there in their own doctor's offices. Already, as of this afternoon, over 1,000 offices have signed up to do this, and I'm encouraging all interested providers to do the same. We have the vaccine, all we need is the doctors. Dr. Ezike will talk more about how physicians can sign up to distribute, and the physician leaders joining us today will, of course, echo this call. This is about making it as easy as possible for those who have not yet gotten vaccinated to protect themselves from COVID-19. For some people, that's a matter of comfort. They'd rather get a vaccine from a doctor they know and trust. For others, it's about convenience. If you're already visiting a healthcare provider for another treatment or checkup, it's easier to get vaccinated on the spot rather than having to make a second extra trip. Whatever the reason, Illinois is doing everything that we can to make this vaccine as easy and accessible as possible for all who want it. This call also applies to pediatric offices. Already, dozens have signed up to be prepped and ready for when vaccines become available to young people ages 12 to 15, perhaps as early as next week. And we encourage every provider that we can offer vaccinations to do so. Please sign up. For doctors, this is not only a great way to educate and vaccinate your patients, it's also an opportunity to offer the vaccine to their family members as well. I also want to provide an update today on the next phase of our COVID-19 public health mitigations. Each day, people in Illinois and across the nation are still getting sick and being admitted to the hospital with this deadly virus. And each day, our doctors and our nurses and our healthcare professionals do everything in their power to save every life that they can, one patient at a time. But the light that we can see at the end of the tunnel is getting brighter and brighter as more people get vaccinated. As a testament to the life-saving, community-protecting power of vaccinations, I'm pleased to announce this morning that the concerning upward movement of cases and hospitalizations that we were seeing a few weeks ago have stabilized. The number of people going into the hospital each day with COVID-19 has dropped. The total number of patients fighting COVID-19 in the hospital is beginning to level off, and our statewide ICU bed availability is above 20%. As a result, on Friday, May 14th, the state of Illinois will move into the bridge phase of our mitigation plan, one step closer to removing nearly all of the remaining mitigations. For restaurants and bars and retail and weddings and public gatherings, this means higher capacity limits and a very hopeful move toward full reopening. And barring any significant reversals in key COVID-19 statewide indicators, Illinois will move to phase 5, normal business operations free of pandemic-related mitigations, as soon as Friday, June 11th. Whenever we reach phase 5, we will continue to follow CDC guidelines on masking to keep this pandemic at bay. This good news comes with a caveat. We have all seen throughout this pandemic that this virus and its variants have proven to be unpredictable. Metrics that look strong today are far from a guarantee of how things will look a week, 2 weeks, a month from now. We saw that last August and again last March. But what we do know is that we have tools in our arsenal, like vaccinations and wearing masks, that, if we all use them, have proven extremely effective. I want to thank people across Illinois who are continuing to do their part to make your friends and your family safer and your communities healthier. Folks, this pandemic is not over. But if we're going to truly end it, we have to make sure that we don't see another surge in the virus. And the best way to do that is for everyone to get vaccinated. Already, millions of Illinoisans have done their part to get protected and help our state. But we need millions more to get vaccinated. And the best time to do that is now. If you haven't gotten vaccinated, we can help you find a shot near you. Visit coronavirus.illinois.gov. Check Walgreens or CVS or Jewel or your local pharmacy, or just call our vaccine hotline at 833-621-1284. If you don't want to make an appointment, you don't need to. You can visit one of our Illinois National Guard mass vaccination sites, all of which are now taking walk-ins. And if you're a pastor or a lay leader of a religious group, or you're head of a community organization or a mutual aid society or a neighborhood association, you can host a vaccination clinic for your community, and we will provide the resources and the staff. You can sign up at dph.illinois.gov/COVID-19/vaccination clinics. Or just go to the DPH website online and you'll be able to find vaccination clinics. Or you can call IDPH at the vaccine hotline at 833-621-1284. And if you can, talk to someone in your life about why you got vaccinated, and then help them do the same. We'll get through this the same way that we've been able to get through this from the very beginning, helping each other and working together. Thank you, and with that, I'd like to turn it over to our state's top doctor, Dr. Ngozi Ezike. Doctor?
Thank you, sir.